The Johnson County Sheriff's Office is offering free antibody testing to all employees. The sheriff says it's a way for workers to get an update on their health, but infectious diseases doctors at the University of Kansas Health System do not believe the tests are reliable. KCTV5's Carolina Cruz is live in Olathe, where those blood samples are taken and then sent out for testing. Carolina?
Hey, Rad. So the sheriff tells me that he's really excited about these tests. It'll run about $150 each for each test, the department tells me. And the sheriff says that this is an alternative to a vaccine mandate, which he strongly opposes. The Johnson County Sheriff's Office is testing out a way to help employees see how protected they are against COVID-19. The agency is the first in the nation to deploy AditxtScore. The sheriff was the first to test it out.
170 of our officers, including myself, have COVID because we were out in the field.
He hopes the test shows his antibody levels after getting COVID-19 about a year ago. About 200 of the agency's 700 employees signed on to try it too.
Then we've got some that think they might have had COVID, they're not sure, and then we've got some that had COVID, they're not sure how long their antibodies last, and then even with the vaccinations, we've had people that have gotten the vax and gotten COVID. So our staff is all over the place.
Sheriff Calvin Hayden says the test may help staff determine if a COVID-19 vaccine is right for them.
You know, we're getting a lot of pushback on, Sheriff, why don't you just everybody get a vaccine and do it that way? Everybody has different health issues.
He says it's not a pro or anti-vaccine decision, just pro-information. Doctors at the University of Kansas Health System say the results are more complicated than a simple score, though. Dr. Steve Stites says there's just not enough data or guidance to support these tests, especially for people who have been vaccinated. He says determining outcomes after contracting COVID-19 includes things such as history of disease, heart health, weight, and more.
And what those tech companies can't tell you is how their number compares to the actual patient outcomes with lots of other variables like the ones we just mentioned. And so to say you're healthy or not healthy, you're safe or unsafe, that is simply not true.
So the test involves a blood draw, and then the tests are sent out in batches of 10. People get their results in about 24 to 48 hours. And Sheriff Hayden tells me that he's seen on social media commenting saying that the information is going to be stored and then given to the government. He says that is not going to happen. He says the results are encrypted, so only the person who got the test can see the test. Reporting in Olathe, I'm Carolina Cruz, KCTV 5 News.
Thanks, Carolina.